Looks
So
good.
yes, thank you very much, Jeanette, for inviting Libby and I to speak with you all tonight. We're very excited to be with you. And thank you, Larry, for the welcome also. So what we're going to share with you tonight is actually a collaborative piece, and you can see, so Libby and I are here with you tonight, but you can see that our other colleagues that were part of this work, Associate Professor Julie Smith, Adjunct Professor Carleen Gribble, and Dr. Philip Baker were also key parts of this work, so we'd like to acknowledge them. My background is as a registered nurse, and I'm an international board certified lactation consultant, and I have a Masters of Public Health. I've been volunteering as a peer breastfeeding counsellor with the Australian Breastfeeding Association for a couple of decades now, since my children were born, and I'm the national coordinator for the World Breastfeeding Trends Initiative in Australia. And Libby, who will be talking a little bit later, is a PhD candidate at the Australian National University, and Libby has been researching the regulation of human milk sharing and also has experience as a vet in agricultural systems and policy making. And Libby is also a breastfeeding counsellor with the Australian Breastfeeding Association and a member of the World Breastfeeding Trends Initiative team. So we will be talking tonight today about building policy coalitions and reframing breastfeeding around first food security. We'll start off by setting the scene, just looking at the state of breastfeeding in Australia and just going over some of the repetitive emergencies we've had over the last couple of years and how that has led to this work. And talking about how and why to build policy coalitions. And then Libby will go into a little bit more about first food security and what it is, and sharing our very own case study for advocating for first food security in Australia. And we will touch very briefly towards the end about how you can use that model to advocate for first food security in your area. Before we go any further, we would like to acknowledge the First Nations people of Australia on whose lands this talk has been prepared, the Ngunnawal and Yagara and Turrbal people, and the First Nations where you all are today. We pay our respects to their leaders, past and present, and show gratitude for their care of the land on which they have birthed, breastfed, and raised children throughout the ages. We will also be using the terminology of woman and mother throughout this presentation. And in doing so, we do intend to include anyone who identifies as such and understand that breastfeeding doesn't happen in isolation, that there are partners and other support people, and they're just as critical to the relationship. We do simply use the term breastfeeding, but acknowledge that there are many other ways to provide human milk. I'm sure that many of you will remember just back to last year when there were dire shortages of infant formula in the US. That shortage was precipitated by the deaths of at least 2 babies, and there were many others who became sick. The formula was recalled and manufacturing plants closed. The company that was involved was actually one of 3 which dominate the US market, and it has been said that maintenance standards weren't quite up to scratch. This image was in the Australian media at the time and implies that Australia saved the day by shipping a plane load of formula to the US, which of course favours the global trade and commercial milk formula manufacturers. But public health advocates at the same time were saying that the crisis probably wouldn't have happened or occurred at all if if breastfeeding had been supported better at a policy level. Attempts by the formula industry to insert themselves and save the day actually happens in many different ways and in different contexts. Formula dependency exacerbates vulnerabilities in low and middle income countries. And this vulnerability is heightened in emergencies and natural disasters. In the Philippines, the importance of breastfeeding in disasters like typhoons is actually well recognised, and the need to protect breastfeeding from donations of formula. Formula donations in the Philippines are banned under their milk code, which is their answer to the WHO code. And that's because donations are recognised as a marketing strategy used by formula companies. A little bit more context about Australia, because that's where our case study is focused. Breastfeeding is pretty much a disaster itself in Australia. You can see some information on the slide, and you'll notice that we've had no collection of national data on a consistent and comparable basis across the country since 2010. And you'll see that exclusivity back then was quite low, and no doubt it's at least that low, if not lower now. Some states in Australia do collect good perinatal data, but these are different from state to state, so we can't use them to say what's happening on a national level. Although there is some very good data that tells us that in at least 2 states, and our 2 major states, 30% of well-term babies have already had formula before they're discharged from hospital, which is usually on about day 1, day 2. Baby Friendly Health Initiative accreditation in Australia is quite low at the moment, with only 21% of maternity hospitals having this accreditation. And we do have a very good national breastfeeding strategy document that was launched back in 2019, but still to this day, 4 years later, there are no clear implementation plans for that strategy, and no associated budget. No national coordinating committee, no targets, no data. In common with many other countries, Australia has seen bushfires and flooding of unprecedented scale in the last few years. In 2019, 2020 summer, we had the Black Summer bushfires, and these fires burnt 7 times the land area that was burnt in the 2019 Amazon forest fires. And in early 2022, very large areas of Australia were underwater, including entire towns. And that was all on top of the COVID-19 pandemic. And like what we're already seeing happening in the Northern Hemisphere throughout their summer, we're now bracing for another catastrophic fire season ahead in 23-24. These disasters and emergencies stress the resilience of communities and expose vulnerabilities. Just prior to the Black Summer bushfires, Carleen Gribble and colleagues undertook an audit of the national disaster plans in Australia, which confirmed that there were a dearth of guidelines for infants and young children, and actually better provisions for pets in Australia in our disaster planning manuals. During the Black Summer bushfires, many people, including families, were trapped on beaches or on rooftops and in evacuation centres. And these were often quite disorganised. There were pets inside the evacuation centres. There was, it wasn't clean. There was a lack of privacy, lack of safe spaces for mothers to breastfeed and care for young children, and often without electricity or clean water as well. So it made it very hard to feed formula safely. In some cases, people with babies, who are usually women, were not evacuated by helicopters because of safety restrictions. And just like the low and middle income countries, disasters and emergencies provide opportunities for commercial milk formula companies to come in and rescue everyone and donate their products freely, come off as the good guys, rather than the formula having planned distribution in a safe and controlled way in places where they're needed. So why does it seem like no one really cares about how babies are fed, or understand the value of breastfeeding to the entire society and not just babies? Why do our political health systems fail to protect breastfeeding? The 2023 Lancet series on breastfeeding authored by two of our coalition, Phil Baker and Julie Smith, among many others, began answering these questions. Their political economic perspective showed how commercial power influences infant feeding policies and creates conflicts of interest, and how gendered economic and fiscal policies fail to recognise women's care work and denies women-centred and culturally appropriate care to women around birth and breastfeeding, which in turn leads to inadequate funding for breastfeeding. So an example of that is the lack of funding and implementation of the Australian National Breastfeeding Strategy that I referred to earlier. Some of you may wonder what we mean by gendered economic policies and fiscal spending, and apologies to those who are across this. But what we're talking about when we use those terms is about how government spending and tax policies deliver overall worse outcomes for women who breastfeed than women and others who don't. Because across their life cycle, these government budget decisions and policies fail to recognise, count and financially support women's unpaid care work and reproductive work that benefits households and societies. On top of these gender biases in policy are other layers of bias that disadvantage different groups of women, and that's because of their poverty, race, language, culture, geographical location, and so on. So the political economy of infant and young child feeding is a bit like an iceberg. Above the surface, where we're working to support mothers to breastfeed clinically, but there's so much that goes on beneath the surface that impacts whether the great work that's done at the coalface, at the clinical level, succeeds or fails. And then there's the work that's at the policy level, for example, in health service management or NGOs and government departments. This work supports the clinicians above the surface, hopefully. Breastfeeding is complex and involves policies across multiple domains and political and cultural ideas. A really important part of the political economy are the players or the stakeholders with interests in particular outcomes. And these stakeholders are usually government organisations, NGOs, and of course, industry. Stakeholders also include less powerful, but just as important actors like mums and families, clinicians, policymakers, and stakeholders operate at all levels of the political economy to pursue their interests. Commercial milk formula companies have enormous resources to pay for social media influencers and political lobbyists to influence politicians in many ways that result in a lack of political interest and inhibits the required policy change. In Australia, commercial interests in dairy milk powder are both local and global in nature. 36% of milk produced in Australia is exported, and commercial milk formulas are one of the most profitable products manufactured from milk in Australia. Australia trades on its clean image, clean and green image, and food regulatory system in marketing these products, particularly to countries like China. Ironically, most of the commercial milk formulas consumed by Australian babies are actually imported. So most of our supermarket shelves are filled with brands from New Zealand, Europe, and the USA. So not all that green at all when transport miles are considered alone. There are so many reasons why there might be a lack of policymaker interest in infant nutrition, and it's just often not a domestic priority. There are few advocacy groups for nutrition in the trade policy environment, and few opportunities exist for health workers and health advocates to influence trade policy. In Australia, we have some very sobering examples of commercial power interfering in the political economy of infant feeding that you can see on the slide, which leads to the woeful breastfeeding and health outcomes that we have in our country. We have lack of code implementation. We're one of the lowest in the world. We have formula companies hosting very expensive political lobbying events at our Parliament House, and there are gaps as well in our labelling regulations. The evidence shows that Australia is a bad actor at home and abroad when it comes to upholding the WHO Code. the Australian government actually provides subsidies to the dairy industry to help them market their product to low and middle income countries in our neighbouring region. Australian government delegations to international policy forums like Codex to set standards for formula actually includes industry representatives. So trade trumps health. So just moving on now to the coalition side and leading into our case study. Back in 2017, Associate Professor Julie Smith convened a 3-day workshop in Canberra at the Australian National University on gender responsive budgeting. And included in that was training for the World Breastfeeding Trends Initiative assessment. We had visitors with us from the International Baby Food Action Network. The WBTI published their first report in 2018, and the work that was involved in that brought together key organisations in a structured way. And as many of you would know, the WBTI is designed as a collaborative process. The tool is used to assess countries on their policies and programs across 15 policy areas to support breastfeeding. And back in 2018, we scored a dismal 25 out of 150, placing us third from the bottom out of over 100 countries that have already done the assessment. The 2023 report will be available on the WBTI website in the coming weeks. It is with them now. And I can tell you that there has not been much change at all. In fact, I'm pretty sure we're still third from the bottom 5 years later. So aside from the WBTI team in Australia, who are the other key players? You can see them here. You can see that the common focus is maternal and public health. This isn't an exhaustive list, of course, and apologies to those that aren't represented here. But each of these organisations, just like in any coalition, brings their own strengths, expertise, and areas of specialty and resources. Political will is not just about politicians, it's critically about fostering and maintaining the will of civil society actors, stakeholders like you and me, to keep pushing for change and building the skills and know-how to work in coalitions and be effective advocates within our political systems. The 2018 WBTI assessment included maintaining communication with key policy advisors in the health department, and that led to our inclusion of the report results in the 2019 ANBS. The WBTI report was publicised in academic papers and conferences and included the IYCFE guidelines audit that I mentioned earlier. That then led to a call for action, and that was co-signed by over 40 organisations. And many of those organisations that signed on to that call to action were not organisations that you would typically think about when it comes to breastfeeding advocacy. So that was quite a success. The follow-on then from that call to action led to the opportunity to apply for grant funding, and this was done through the Australian Breastfeeding Association, led by Carleen Gribble, and they were successful in applying for that grant, and that funding and the project is still in process, but it has led to quite comprehensive qualitative research with families who experienced the bushfires, and will be translated into resources and training and pilot tested in a small community in New South Wales. I am going to hand over to Libby now. Thank you.
Okay, thanks very much, Naomi, and thanks again to the Breastfeeding Collective for this opportunity to chat to you. I'm going to really outline an approach to tackling this policy neglect and a way to capitalise on work that's been done on infant feeding in emergencies by using this concept of first food security and showing how it builds on our current definitions of food security. So the FAO defines food security as a situation that exists when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food. But food security is not just a supply of food. Food security has 6 key dimensions. It has to be appropriate nutritionally, culturally. It has to be available, accessible, and that means also affordable. And it has to be used efficiently, stable in supply, and sustainable. Breastfeeding ticks all these food security boxes, but only if it's properly supported. It's important to note that breastfeeding is different to every other food because it involves women's bodies in social and cultural systems of support. Food security is also a political concept. There's a clear relationship between food security and women and children's rights to breastfeed, their economic and political rights. For many years, infants and young children and breastfeeding missing in mainstream food security policy, which was more about piles of wheat usually than healthy diets. The idea of first food security builds on these basic food security concepts and adds 2 components. First food security recognises that breastfeeding is critical first food for infants and young children. But it's very important not to think of first food security as just breast milk. First food security is based on food systems approaches applied to the breastfeeding diet as a first food system by Phil Baker, developed from earlier work by Julie Smith and others. So food systems frameworks emphasise the structural factors that are important to the provision and distribution of food and the avoidance of dependency on commercial milk formulas. Secondly, first food security recognises that breastfeeding should be central to national food security policy. Breastfeeding is arguably the world's shortest and most valuable food supply chain, but it's easily disrupted when breastfeeding is not protected, promoted, and supported. So, how can we apply this concept? First food security is clearly relevant to emergencies. As Naomi has shown, breastfeeding and not expressed milk provides secure nutrition in natural disasters. These events are urgent, life-threatening, and infrastructure and systems fail and reveal our dependency on formula, exposing our low rates of breastfeeding exclusivity and duration. First food security also applies to other types of emergencies created by disruptions to formula supply chains and contamination scares, as shown last year. But first food security is not just about emergencies. It also emphasises the importance of breastfeeding to household food security in everyday life, in the suburbs and in workplaces. An important concept in framing breastfeeding as food security is that breastfeeding has to compete with infant formula across all the dimensions of food security in terms of appropriateness, availability, access, affordability, and so on. An important misconception in food security circles is that breastfeeding is free, when we all know that women's labour is not free, and for many households, breastfeeding is unaffordable, especially if paid maternity leave is not available or adequate. This affects the poorest women most, those in low-paid and casual jobs, especially in the informal economy. And those dynamics can shift between high and low-income countries. So everyday food security shines a sharp light on inequities in breastfeeding in any society. So how have we used it as an advocacy tool? We believe that first food security has potential to generate political will to fund breastfeeding policy and reform. It does this by shifting the way breastfeeding is framed from optional to critical, shifting breastfeeding policy agendas, policy forums away from health, where it has been, certainly in Australia, fairly neglected. Most importantly, it challenges commercial power and takes on political economy, infant feeding and breastfeeding. So let's look a little more closely at how first food security does this work. Going back to the diagram of the political economy of infant feeding from the Lancet, we heard how this depressing cycle enables trade to trump health. First, food security can disrupt this cycle in several ways. First, food security makes and frames breastfeeding as a solution, not a cost, and highlights that dependence on commercial milk formula is a vulnerability at the national level. And looking more closely still at how first food security counters commercial power and its messages, we start here on the right-hand purple side of this diagram and show that first food security counters marketing messages about breastfeeding being an individual choice. In disasters, a woman's capacity to breastfeed depends not on her preference, but on her circumstances, a safe place, encouragement, and skilled support. Food insecurity in emergencies and households shows that breastfeeding is not just a woman's health issue and brings attention to the structural barriers to breastfeeding and exposes gendered economic policies. First, food security highlights the vulnerability of countries and communities dependent on formula and exposes the fiction trade in formula provides food security. It exposes the role of countries like Australia that undermine the WHO Code at home and in other countries, and really calls out the dairy industry interference in policy and research. Moving around to the lower and left side of the diagram, first, food security creates a sense of political urgency around breastfeeding. Disasters have a big media profile and demand government action to step up. They're political events with political consequences for politicians. In these politically fragile situations, first, food security has a positive story and shows that breastfeeding is part of the solution, as I said, and not a cost. And under conditions of climate change, we're forced to think that we can't go on with business as usual. Climate change shows that spending government dollars on breastfeeding is an investment in national resilience, as an adaptation to climate change. It reframes industry interference in breastfeeding policy, tax avoidance, as increasing national vulnerability, as blocking climate change adaptation, highlights the role of government. Even more importantly, these disasters show the importance of breastfeeding to climate change mitigation by reducing the greenhouse gas emissions from the dairy industry, formula manufacture and transport, their contribution to environmental degradation, water use and contamination, fertiliser, fuel and packaging waste. So how did we pull all this together and apply it in a case study in Australia? We had, in October 2022, the Australian Parliament announced a national inquiry into food security in Australia. Being aware of stakeholders in infant feeding, we were keen to understand who was running the inquiry and their interests. It turned out that the inquiry was run by a Parliamentary Committee for Agriculture, consisting of 9 politicians from electorates in rural areas, including areas with dairy farmers, and at least one, though, was from the area where the Australian Breastfeeding Association bushfire project is located and mentioned. Importantly, the inquiry was not just about food security in Australia, but also about protecting our export markets. Put here in moral terms by one of the committee members, we have a responsibility to help the world feed itself. So what were the issues that prompted the inquiry? Australia had thought of itself as a food secure nation and a food exporter. But in 2022, the cost of a lettuce reached $12 when it usually costs $2. Floods had affected primary production and supply chains, and the COVID pandemic had disrupted the workforce. These emergencies and disasters disrupted our complacency as a food secure high-income country. We wanted to present to the inquiry a feminist economic perspective on this situation that highlighted that breastfeeding is a poorly recognised but valuable form of primary production and lay bare the political economy of breastfeeding. And we wanted our submission to be on the public record as part of the policy-making process. To bring greater authority to our submission, we needed a broader coalition than the usual suspects around breastfeeding. So we added experts linked to networks with a national profile on obesity, political science, disaster planning and response. In our submission, We were careful to address each of the inquiry's 4 terms of reference. These were about food production, consumption and export, key inputs like labour and costs, supply chains and their effects on costs and the distribution of food, the threat of climate change to food production. In our submission, we stated with copious published scientific and economic evidence that breastfeeding women were primary producers, that the 42 million litres of breast milk they currently produced is value to the economies of food to the tune of $3.6 billion annually. We pointed out key inputs to breastfeeding were women's labour and costs, and the importance of covering this with paid parental leave, and we described the minimal added food energy required for breastfeeding. We described breastfeeding as having an exceptionally short supply chain, which improved resilience in emergencies, but required prior investment. And finally, we pointed out how breastfeeding is an effective strategy to address climate change, because breastfeeding adapts to and mitigates climate change impacts of dairy and manufacturing. So, what was the response by the submission? The committee's response was to bury, then reject our submission as out of scope, and refer us back to a committee. This firmly backing the issues. The committee told us they didn't want to be perceived likening breastfeeding to commodities.
Libby, I'm going to interrupt for just a moment.
Yeah.
We're losing your audio slightly. You want to try again for a moment?
So,
sounds like your Bluetooth might be dropping in and out, Libby.
Exactly.
Bluetooth.
Or are you plugged in your headphones?
I'm using a direct plug-in.
Yeah, your audio just got a little bit worse instead of better. Try again.
So the committee told us that they didn't want to be perceived. How does that sound?
Yeah, we can't quite hear you. I don't think it's audible enough for us to hear. I don't know if it would help to switch to the mic on your computer as opposed to your headset, possibly. You were fine up until a moment, and then it just dropped out.
Okay, how does that sound? Sorry about the...
Oh, I think that's better.
Yeah, that's a bit better.
Go ahead. Okay. Thank you.
All right, so how did the Committee on Agriculture respond to our submission on first food security? Well, first of all, they buried it, and then they rejected it as out of scope, referred us back to a Committee on Health, putting us firmly back into our women's issues box. The committee told us they didn't want to be perceived likening breastfeeding to commodities of agricultural production. Have a negative perception. So how did we respond? We wrote to the Agriculture Committee and pointed out the Lancet series on breastfeeding and the other published evidence that Australia is a bad actor regarding the WHO code and formula exports. Then we wrote to every member of Parliament that we knew across the physical spectrum, portfolio or special interest in women, health or agriculture. Now we have 2 houses of Parliament in Australia, a House of Representatives and a Senate. So we had to work across both houses, their committee structures, and also the independent members of Parliament who currently hold a lot of power. We've got strong interest and offers of help from the Greens Party and independents, some of whom had electorates that were really severely affected by the fires and floods and had strong interests in climate change and preventative health. These responses reflected their ability to tie together the related concepts of breastfeeding as a cross-cutting food issue across women's issues, health and agriculture. Some of these members had breastfed their own babies in Parliament, open taboos with much publicity. Others needed to be brought up to speed on breastfeeding statistics and policy neglect in Australia, much to their amazement. It was a valuable learning exercise. The outcomes of this political action was pressure from other members of Parliament who became champions of our issue. So what were the overall outcomes? These parliamentary champions helped to get our submission back in the food security inquiry on the parliamentary website, where it contributes to public debate. And you can access the submission yourselves. One independent senator put pressure on the Minister of Health to fund the National Breastfeeding Strategy and received a letter stating that the government would develop an implementation plan by the end of the year. This is not quite the funding we wanted, but more than about public. Importantly, this exercise in shifting the forum for breastfeeding from health to agriculture also encouraged some other submissions to the inquiry to mention infants and young children in breastfeeding. It helped to link up with and bring attention to other breastfeeding advocacy campaigns in Australia around the food code, which are currently running. So I'll hand back now to Naomi. She'll talk about adapting some of these ideas to situations.
So thanks, Libby. This is actually a slide that I've adapted from a presentation that Jeanette did at the Code Congress in Geneva. So it's really just stepping through a process of advocacy. And I'm sure that there's probably many of you who are here who are much more experienced in advocacy than myself. So bear with me while I work through this one. But there are some really simple steps to follow when you are advocating for an issue that's important to you and to your colleagues. So, of course, it's always started by defining the problem, and that's usually what brings some of you together, and assessing the landscape. And you can use the PESTLE methodology, which is looking at the political, the economic, the social, technological, legal, and environmental factors around that problem. So that informs you and helps you to understand exactly what it is that you're aiming for. And it also enables you to choose the right tactics and watch for those winnable fights. It's important to have very clear messages around the problem and around what your desired outcomes are. And then you can go about building your coalition and finding who your allies are. And the important thing when you're finding your allies is finding the ones that are outside your usual, who your usual players are, because then they will bring with them their own networks and their own resources and just helps to expand the cause. And in that process, hopefully, you will be able to find some change makers and champions and people who have the right connections and the strong voice, and enables you to really make your issue clear and loud. And of course, then throughout the whole process, it's important to be monitoring and evaluating. So in our case, and the case of many others around the world as well, pushing breastfeeding into food security forums and food systems has taken time. There have been submissions made in the past to the FAO and other United Nations forums, and those attempts over time have been important in raising the issue of infant feeding and global food security. And a good example is the report on the state of food security and nutrition in the world that was released in July this year. And breastfeeding is mentioned well over 100 times in that report. So this talk has hopefully given you an understanding about the power of first food security as an idea, what it means in emergencies and everyday infant feeding, and its potential as a disruptor of commercial power. And I guess that's really the key message that we want to get across. We've pitched this first food security to using a case study to show how we used the concept to shift breastfeeding policy framing, forums and agendas, and to get some political traction for breastfeeding. Ours is only a very small example, but we hope it gives a sense of possibilities in the larger scheme of things and the political economy of infant feeding. Whether we're working locally or globally, there are many contexts, coalitions, and opportunities for first food security. And we hope that this concept can go a long way to help you and other breastfeeding advocates in your efforts to fight for political commitment and funding for breastfeeding. And just acknowledging our colleagues and team once more. And we do have some references that are available in the slides. Thank you.